Hello, I'm Chris Kotlowski, and I am thrilled this morning to be with Anne Marie Olson. She is a licensed clinical social worker and has a master's in social work and marriage and family therapy. She is a partner with Mental Health Solutions in Madison, Wisconsin. So thank you for taking the time to meet with me.
Absolutely, I'm thrilled to be here.
Thank you. So we are going to just talk about our mental health.
Yes.
And this is going to be a quick interview. I want you to stay through to the end. It's going to just be informative, but also maybe give you some insights so that if you are ever thinking about it, maybe this will help you pick up the phone, make your first appointment, because I have been there. Reaching out and going to talk with someone can be scary.
It can be scary,
Yeah, so just maybe start with either a little background or people that you work with,
Sure.
all of it.
So I have been doing therapy for 20 years. I started out in nonprofits and I've worked my way through different agencies and now have been in private practice for a little over 10 years. And my population that I work with ranges from age 4 to, my oldest client currently is probably in their late 70s. And so I see kids and families and I see couples, I see, all sorts of different people. There's a lot of sort of what we would consider to be general mental health,
Okay.
which would cover things like depression, anxiety, family systems
Okay.
type stuff. So, just people that have challenges with family histories or current family situations
Transitions
in life. Yeah,
PTSD.
absolutely, PTSD. And then a lot of the kids that I work with have things like ADHD,
Okay.
Anxiety, social anxiety. The pandemic has brought on a lot of both social anxiety stuff as well as feelings of isolation and just lack of connection because kids and adults, right, are not having as much connection and interaction with each other just by the nature of what we've been in for the last 9 months. So.
And I think with life, when we're living it, we're thinking and it's confusing. And as simple as this sounds, it's my new favorite quote.
Yes.
If something feels off, it is. And if you are to a point where you're still kind of muddling in the emotions or the conflict or whatever it might be, and you haven't been able to resolve it, it is best to pick up the phone and just talk to someone that doesn't know you maybe.
Yeah.
What do people feel when they come in for their first appointment, and what should they expect?
Yeah, first appointments are a lot about the therapist, so myself, is looking for, what's your presenting concern? Like, do you have something that you are immediately experiencing that is, is concerning you? Are you feeling a lot of anxiety? Are there depression symptoms? What is it that is like immediately going on? And then we gather background information. I like to know, what kind of family you come from, what your current family situation is, what kind of support systems do you already have. My experience tells me that everybody comes in. I don't have anybody that doesn't come in that doesn't have strengths already.
Right.
So I very much in the first session always want to identify people's strengths. Because it is a hard thing to come in, and I think a lot of times people feel that they don't want to air their dirty laundry or they don't want to acknowledge things. Sometimes just acknowledging that something is hard and just that taking that step to ask for help brings up a lot of anxiety and like worry and embarrassment. There's shame sometimes associated with that for people, and so that first session is really about getting comfortable as you can, getting to know the person and what their concerns are, as well as some background, and then starting to develop a relationship. The relationship you have with your therapist is so important. And I always tell my clients and other people that I work with, if you don't have a good connection with your provider or your therapist, then you need to look somewhere else.
Right, and that's okay.
It's absolutely okay.
If I was to see you, if it doesn't click, it's like with any relationship.
Yeah.
If it just is like you have to effort it and you have to really work on it, then it's not natural, and you won't be as successful as you would have been.
Yeah.
And that's okay.
There's actually a study, the American Psychological Association did a study a few years back where they looked at different aspects of a therapeutic process and asked people who had been in a therapy process what's the thing that helped them the most, and it's like a pretty high statistics, like 92% of people said their relationship with their therapist was the most important thing that led to positive outcome. And so I think that speaks volumes for how important that is.
And I think with feeling the fear and taking that first step, walking in the facility and sitting down, it just gets easier. The second appointment, third appointment, fourth appointment. And I think just finding clarity, peace of mind, and really just allowing our feelings.
Absolutely.
I think so many of us have a situation and we think, well, time will heal it or it'll change. But if we don't get to the root and deal with it either on our own or with our family and friends, its ugly head will rear with us, right? Because there has to be resolution within ourselves. We can't control our exterior or what people are doing,
but you can control yourself, and that is, of all the things in life, the things that you have the most control over have to do with the things that you decide for yourself. And there's choice in everything, and I think that's something that people forget, is that they feel like, well, I don't have a choice, or well, you do have a choice. You may not like your choices,
right?
But you have choice, and that in and of itself is a positive. So I think choosing to, if you have exhausted, like you're talking about, Chris, like if you have sort of like exhausted your support systems with friends and different things, and you feel like there are things that are just bigger than what you feel like your friends or your family can maybe talk through with you, then that's where a therapist is a great person to do that with, because we're invested in your life, but we're investing in your life in a very different way than your friends and your family. I care about my clients, I'm invested in their lives, but the boundaries are different.
Right.
It's a different kind of relationship. It's not reciprocal, which is a huge important.
That is really a key point that I had never thought of, and just being able to breathe in the moment and know that you're going to help anyone you see be sad and be okay with it, be angry and be okay with it, be very joyful and happy with whatever. And I think there's so many expectations that are put upon us where we're confused at, well, what should I be feeling, or how should I handle this, and so and so handles it one way, and living is not simple,
right?
But it can be clear with help, instead of just hitting our head against a brick wall. It was interesting when you said I'll say 4 years to 84 years old. And I think personally, when we are young and seek help, whether it's a teenager or maybe you're a young couple, learning the skills to, well, what would I learn as to be independently, and then to say, oh no, I think I'm going to come back and talk to Anne Marie. What skills do you help people identify? You know that they have positive attributes,
right?
And we all have negative.
So some of the common goals of therapy, and everybody's situation is unique, and of course I very much meet people where they're at. I'm very client-centered in my approach, but there are some common goals typically.
Okay.
So a lot of times, no matter what people come in with, we need to work on feeling identification. Just identifying other feelings besides anger and like mad, sad, and glad. I mean, it's
Right.
like those are sort of like the
Isn't
basics,
there a
right?
wheel of emotions?
Oh, yes, there is.
Aren't there a lot of emotions?
There's a lot of emotions, absolutely.
Not just those three or
Not
four.
just those 3 or 4. So we gotta get used to identifying emotions, and then taking responsibility for our emotions,
Yes.
and that emotions aren't, and to stop judging our emotions, and that's
point.
that's a very important thing that a lot of people like. Well, I shouldn't, I should feel this way, I shouldn't feel this way. Ugh, we want to get rid of should.
Okay.
One of my favorite friends, we are in a business group together, and she talks about not shoulding on yourself, and it's so true, because we want like that. There's just not a good use for that word in our vocabulary. So we want to work on identifying our feelings, owning our feelings, and saying it's okay that I feel this way, and then learn healthy ways to express emotion, which is really a key thing for everybody. You know, expressing your emotion in healthy ways, not apologizing for emotions. I think we're sort of are in a society where culturally, you know, it's not, it's not hip, or it's not like to, you know, but I do think, and Chris and I were talking about this a little bit, like that is hopefully changing.
Yes.
We're working really hard in mental health to change the stigma of mental health, and through this pandemic too, there's been a lot of push for highlighting mental health, because the pandemic has really impacted the mental health of humankind. So we you know, it's getting highlighted more, which is, I'm so grateful.
That is
I've
wonderful.
been fighting for that for my whole career, you know. So yeah, so I mean, those are some common goals. So a lot of it has to do with, you know, like I said, feeling identification, healthy expression of emotion, and then a lot of times, I call it like the umbrella that most things are underneath.
Okay.
Our interpersonal relationships, and understanding boundaries in interpersonal relationships, understanding emotional boundaries, certainly physical and, you know, intimacy boundaries. Those tend to be the goals, sort of in a general way, that people come in for, and we can identify.
Are you, with your patients, you meet with them for an hour, so it's what happens all those other hours, you know, until they meet with you again.
Right.
Do you identify things like, let's take in baby steps, let's work on this, and then we'll, and then that's a process that isn't overwhelming.
Right.
I think that a lot of people say they get to middle age, we don't want to go back and deal with maybe something that was 20 years ago or 15 years ago or even 10 years ago. But how we are right now could be stemming from that.
Absolutely.
And it's just unresolved, maybe some conflicts, forgiveness, whatever it might be, with the goal of release, allow, and then expand forward.
Right.
Is that
absolutely? Yeah, I mean, people don't always want to go back and like rehash what their childhood was, or sometimes, you know, people say, oh, I don't want you to psychoanalyze my childhood. Well, that's not necessarily what I'm there to do. You know, we can talk about it, and sometimes we don't need to. It's like, you know, sometimes people come in and they're like, you know, I know what happened. I get why I am the way I am. I just need to figure out how to do it differently.
I'm right here in this moment.
I'm right here.
How do I go forward?
Right, exactly. And I do think that some language is really important. I talk a lot with clients about language in terms of how you talk about yourself, how you talk to others. Communication skills is another really important thing that I do a lot of what we call psychoeducation on.
Okay.
And so identifying again just how you treat yourself, and that language that you use, and what language you put out into the world, is so important.
And so I think let's get rid of the stigma of mental health or mental wellness. Really, it's you know, learning skills that we can use in everyday life. How are we thinking about ourselves, and what are we saying internally to ourselves, what are we saying to our children, and really taking ownership and responsibility. And I love what you said about let's not judge how we feel.
Right.
We can identify with how we feel, but then the conversation is not you, it's I feel. Is that kind of the terminology that you would say, let's just sit?
Yeah, and I think people getting to a place of being able to say, I feel this when this, and be able to own, and that ownership, that sense of ownership around your feelings, and that it is, and I say this to a lot of kids in particular, because kids will say, well, he made me feel this way, or, well, yeah, so people's actions absolutely impact us.
Right.
Of course. But how you feel is how you feel. So if someone else's behavior is soliciting such a big emotion in you,
yes,
then you gotta look at that, because it's probably not just about what one person said, it probably has to do with other stuff too.
right.
And so that's where the ownership of emotion really comes in, especially for kids in particular, but also for adults. I mean, there's a lot of adults who really struggle with identifying emotion and who really struggle with healthy expression of emotion, and either push it down or just don't, express it in negative ways, and it comes out. So that's sort of, I feel like if I see 8 clients in a day, I'm probably talking about stuff like that at least 7 times,
Well,
so.
and don't you think it's just natural as we go through the stages of life, we can build up those walls to the point where we may not know how we're feeling.
Yeah.
And we may be angry but fearful to speak our anger or express that feeling.
Yeah.
And so I just think that disconnect, once our thinking mind and our feeling mind or body connects, it's that's our goal, isn't it?
Yeah, and I think a big concept too in therapy, and something when you think about going into a therapeutic process, is self-acceptance and self-forgiveness. So, people, just understanding that and accepting yourself for who you are, and that you have emotions, and that's okay, and whatever your emotion is, it is. What you choose to do with it is up to you, and that you get to choose and to feel empowered.
Empowered, what a perfect word for that.
And to really empower yourself to express yourself in healthy ways, you will feel so much better.
And I think, and I want to look at you right now, so many of us feel we're the only one. I'm all alone. And I would say so many times, I'm like, I'm on an iceberg out there. And then when you open up and you start talking, your relationships become deeper, and then you realize, oh, you have the same stuff I have.
Exactly.
Let's just talk about it.
Exactly.
And then it's freedom, and that brings joy. Have we covered what we wanted to talk about?
I think if I was going to leave the group with anything, I would say most of us do a really good job of taking care of our physical bodies, in terms, especially in this group for Rise Up 21. We do a really good job of taking care of our physical bodies. We go to the doctor, we get our checkups. For all us women, we do our mammograms, we do our different things. And we get our teeth cleaned every 6 months. Maybe sometimes we have to think about our mental health.
Yes.
And doing even just a checkup with our mental health. And you can do that with a therapist, you can do it with friends, but just don't hesitate to take care of your mental health in the same way that you would take care of your physical health, your dental health.
That's wonderful. It's common sense, right? So let's do it, people. So thank you for watching it to the end. And I'll put Anne-Marie's contact information if you want to give her office a call and just inquire about who. There are many people that you work with, not just you. So, or maybe you know of someone that you've wanted to reach out to. Maybe there's a good friend that you just want to chit chat with, or a pastor, or anyone. But do yourself a favor, and what was my quote? If it feels off, it is. And keep it simple, and and don't overthink it. Just take care of yourselves. And I appreciate you taking the time.
Absolutely.
I've had butterflies to be able to sit down and maybe if you have a thought or a topic in regards to parenting, grandparenting, your child's in high school, you have a toddler or whatever age, maybe this will just give you that inspiration to talk about it. So, and if you have a topic, that's where I was going, post it below and give us the feedback and suggestion, and we'll do our part.
Yes,
Okay?
absolutely.
All right, wonderful.
Thank you so much, Chris.
You're welcome. Thank you, guys.